I think it'd be wrong of us to ignore the war in Ukraine. And just to tell you briefly, we're about to hear from someone from Ukraine. We in the Alliance, when the war started, the first thing I did was I looked up LinkedIn and I discovered Oleksii Iaremenko, who we're going to hear from in a moment. Linked in with him. 10 minutes later, we were speaking on WhatsApp. He was in a bunker in Kyiv on the first couple of nights of the war. Since then, though I've never met in person, we speak very regularly. And we have now, as an organization, had our first Ukraine ecosystem meeting about a month ago. We intend to extend that to the rest of Ukraine, to Kyiv and Odessa and Kherson, all these names we suddenly know now, because like you, well, I'll tell you what I felt. I knew little about Ukraine. I had no idea of the scale or size of it, or the impact it could have on food supplies in the world. And the reality is you cannot ignore something which is affecting real people on a daily basis, on a horrendous basis. So I asked Oleksii Iaremenko, who's from the Ministry of Health. He is now in charge of the recovery program for Ukraine for healthcare. So his role is to say, where are we? What do we need to do? How are we going to do it? When are we going to do it? And the reality again is that in these aftermaths of war, and hope there will be eventually an end to the war, the reality is there's always opportunity and need. So he is appealing to you and me to get the word out that there is a recovery program on health specifically and other aspects of the economy. So if we could play the tape from Oleksii. He decided to pre-record just in case he couldn't do a live presentation to us, which I thought was a sensible thing to do. So if we could play that recording, please.
Dear ladies and gentlemen, distinguished member of EACHA Alliance and attendants of the Global Health Connector event, I'm Oleksii Iaremenko, Head of the Health Recovery Office under Ministry of Health of Ukraine. Today I want to discuss a subject of profound importance: the reconstruction of Ukraine healthcare services through the digital health. The resilience of Ukrainian people is legendary, but even legends sometimes need a hand. Digital health might just be the hand we are looking for. Ukraine's health system, even before the challenges of past decade, grappled with infrastructure weaknesses, financial constraints, and legacy of outdated Soviet-era practices. Recent geopolitical challenges have further tested the limits of already strained system. Unprovoked war brought more challenges. Russia targetedly destroyed critical health infrastructure. As of today, there are 1,400 healthcare facilities damaged, around 190 completely destroyed and cannot be restored. 1,600 pharmacies destroyed and damaged, and we have 5 regions with the healthcare infrastructure most affected. It's Kyiv, Chernihiv, Donetsk, Mykolaiv, and Kharkiv Oblast. You can see some pictures of current healthcare damages and pictures that show how Russian military aggression destroyed Ukrainian health system. Rapid damage assessment RDNA2 conducted with the World Bank and national authority showed that for the next 10 years, Ukrainian system will need $16.4 billion for recovery and reconstruction. It includes scale up of critical health services like rehabilitation, mental health, access to primary health care, health emergency preparedness and response. Over 500 million urgency needed this year as investments and service delivery and reconstruction. Restoration of the health system, it's not just a matter of infrastructure and availability of funding resources. We must use new technology and expand the availability of health services to improve the quality. Ukrainian healthcare, e-healthcare, start reforming in 2016. That time we had outdated system that is shown in a first picture, where all documents was on paper. Now, as at end of 2018, 99 state healthcare facilities change ownership and become communal not-profit enterprise, and 98% level of computerization. eHealth in Ukraine start operating since 2017. The central component, central database was created to allow national counterparts have one critical system, and all medical information system that provide services to the healthcare facilities, to the patient, can connect through the API to the system that are run by National Health Service of Ukraine and Ministry of Health. Our strategy is to create a single medical information space, fully transition from paper forms to structured electronic medical records, ensuring integration into the global medical information space, use international medicine and information standards, provide public availability of aggregated data on healthcare, and enable environment for development critical decision support system, personalized medicine, telemedicine system for providing big data, and other facts and buzzwords. As is today, Ukrainian electronic healthcare system huge. We have more than 35 million patient registers, 2 billion electronic medical records, 17,000 medical and pharmaceutical institutions joined eHealth, more than 360 million electronic referrals, 62 million electronic prescription, and 20 million medical certificate for temporary incapacity of work. As you see, the system is really huge, and it's growing every day. Digital health, as many as you're well aware, encompasses a broad range of tools from electronic health records to telemedicine, to artificial intelligence and more. The potential of these technologies to revolutionize healthcare is limitless. One of the critical issues Ukraine faces is the decentralized nature of its healthcare infrastructure, often characterized by a disparate system. Digital health can and now it's a bridge this gap, offering an unfilled interconnection platform, which could based electronic health records patient in Lviv can have their medical history instantly available if they seek treatment in Kiev. Digital platform can also add in a rapid training healthcare professional. Virtual reality and augmented reality can stimulate surgeries, medical procedures, and patient interaction, ensuring that next generation of Ukrainian doctors and nurses are prepared for the challenges ahead. Here you see a list of services, e-health services that are already available and fully introduced. There are some specific services are already available for patients. It's a declaration with a family doctor, e-prescription, e-sick leave, electronic referral, approvals to the medical data, and medical document, including COVID certificate and other. The war pushed us to explore opportunities from telemedicine in regions where physical infrastructure is compromised, or lack of specialists, or infrastructure was damaged and people need to move their houses to another country or region, telemedicine can provide here critical services. For patients in rural or war-affected areas, vital consultation can be difference between timely treatment and prolonged suffering. And here the list that telemedicine projects based on humanitarian support from different countries are already piloted and implementing. And it's great opportunity for patients, for doctors to have this connection using the e-health technology. Investing in digital health is not just about improving patient care, it's about economic revolution. A robust digital health ecosystem can stimulate innovation, foster startups, create jobs, and make Ukraine a leading player in global digital health space. No transformation can occur in isolation. International organizations, tech companies, NGOs, and the Ukrainian diaspora all have a role to play. With the partnerships, both local and international, Ukraine can not only rebuild its health system, services, but also lead the way for other nations to harness the power of digital health. In conclusion, the further of Ukrainian healthcare system is digital. With the right investment, partnership, and vision, digital health can act as catalysts, accelerating and robust of a health system that not only meets the needs of the citizen, but also sets a standard for the rest of the world. Thank you for your attention, and let us work together towards a healthy, digital empowered Ukraine.
The only thing I would add to that is that I'm glad we brought you the messages, the real messages from Ukraine. You can see immediately the needs, but you can also see the determination, which I think they're also showing on the battlefield, but also the determination to use this horrible event to turn it into something good for Ukraine. So Ukraine can become, and this is my first conversation with Oleksii a year and a half ago or so, which was, this is a situation where the old word of crisis and opportunity words come in. This is an opportunity for Ukraine to help its citizens, but also it's an opportunity for us to help them, to then eventually help us, because the economic opportunity is obviously on the screen. So I will WhatsApp Oleksii and thank him, and we will keep you up to date with our efforts in Ukraine. Thank you.